And I'm Minerva Delgado. Thank you for joining us for Collective Impact and Hunger-Free Communities. I am thrilled that I'm joined this afternoon by my colleagues Amanda Bankston and Megan Lovelace, and they're going to introduce themselves when they speak as well. Thank you for joining us. We know you have lots of workshops right now to choose from. We appreciate the fact that you've come to join us. And before we get into the topic, we do want to get a sense, you know what, I think I'm going to hold on to the poll for just another minute or two. Let's see if we get some more people to join us. But let's go to the next slide. So we're going to start by talking a little bit about just an introduction to what are Hunger-Free Communities, what is the Hunger-Free Community Initiative, what is our theory of change, and demonstrate how this approach is evidence-based. And then we're going to talk about implementation and practice, and what are some of those challenges that you want to discuss. So we are going to encourage you from the very beginning. Don't wait till the end to put your questions in the chat. If you have questions, we want to be able to address them. We definitely will leave lots of time at the end, but go ahead and start putting those questions in the Q&A. So let's go ahead and launch that poll now. We're really curious to know, are you currently part of the Hunger-Free Communities Network? This is the official Alliance to End Hunger Network. We're currently partnering with about 70 groups in 33 states. So if you're currently part of the network, please say yes. If you're not, please say no. If you're not sure, you know you're part of a hunger relief or a hunger-free network, but you're not sure if they're officially a member of the Alliance, that's okay. Just say I'm not sure. So go ahead and submit your results, and we'll give folks a second to take the poll. And then Mary, if you could tell us what the result of those that poll question is, that would be really helpful.
Okay, I'm just going to give it another minute and then I'll end it and let you know.
That sounds good. Let's go to the next slide. And in addition to in the Q&A, putting in your questions, also feel free as we're talking, if you have experience with some of the things we're talking about, go ahead and add your comments to the chat. And like I said, later on, we will be taking questions and addressing your concerns. We really want to have a very robust conversation. So part of my responsibility at the Alliance to End Hunger is to oversee our Hunger-Free Communities Network initiative. And it's actually one of the more fun things I do at the Alliance. I get to work with folks who are on the front lines of hunger relief in their communities. They may be at food banks, they may be at No Kid Hungry campaigns, they may be working for a local health department or the local Department of Education, or they may be from a food pantry that's being sponsored by a faith-based organization. One of the great things about our network is that it is incredibly diverse, and each one of these initiatives, if it's a coalition, many times it's a coalition effort that's led by one of the organizations I might mention, or sometimes it's a standalone organization whose mission is to end hunger in their communities. But part of what we do at the Alliance to End Hunger is to support the Hunger-Free Communities initiative and bring sort of this network together from all over the country so that San Diego Hunger Coalition can communicate with Hunger Free Vermont, can communicate with Tampa Bay Network to End Hunger, and Hunger Free Oklahoma, for example, just to give you a sense of the reach and the spread of some of these organizations. Well, what we do with the Alliance is, we work with these initiatives, and we support them in the work that they do to end hunger in their communities. We do that through training, technical assistance, and promoting an impact framework that we'll discuss in a second. So what we try to do is bring everyone together for shared learning. We have quarterly webinars. This annual conference is a big part of that. It's about deepening our knowledge of hunger in the U.S., what it looks like in different communities and different geographies in the U.S., and what's working to solve it. It's also about building the capacity of our partners to better coordinate the work that they do and to increase their impact. So that's how we at the Alliance work with the Hunger Free Communities Network. And I'll get into our impact framework in a second. But first, do we have the results of that poll?
We do. We do. It looks like 50% of those said yes, 40% said I'm not sure, and 10% said no.
Okay, awesome. Well, thank you so much for that. It's we have a bit of a mixed audience here, so I won't assume you know all of this in advance. So that's good to know. So what is the Hunger Free Communities Impact Framework? We at the Alliance to End Hunger use this Hunger Free Communities title in many different ways. It's the name of our initiative. It's the name of our network. It's the name of our conference. But it's also a concept, right? Hunger Free Communities is an idea that that behind which no community in the U.S. should have hunger, and that we believe that solving hunger is something that's very achievable. We've put together an impact framework to help guide our partners, and we did this. We put this together. I put this together, really reflecting on the work that you all are doing in communities, and also based on the work that I did for a very long time at the community level doing anti-hunger work. And so basically the way the arrow goes just from the bottom to the top is like greater impact around addressing hunger in communities. And so the basis of this is collective impact, the idea that we are stronger together, working across sectors in our communities, involving all actors in the food system and communities to the table to work together. And so we start with awakening. This is a recognition of food insecurity in your community. By the way, there's a handout at the bottom of your screen that has this framework, so feel free to download it for yourself, although we will also post these PowerPoint slides. So awakening is just understanding that there's hunger in the community that needs to be addressed. Responding, typically in this stage, we see the development of emergency food providers. We see groups that are working to connect people to federal nutrition programs like SNAP or WIC, or making sure that children are signed up for school meals, for example. But typically at the responding stage, we don't see a lot of coordination among organizations or sectors. Coalescing. In the coalescing stage, we see that there are key community stakeholders that are calling groups to action, bringing them to the table, identifying leadership and organization that can move a coalition effort forward. Formalizing is where groups really begin to cooperate and coordinate with each other, that individuals start to identify as part of a hunger-free community network. And it may have many different names. In some places it's Hunger Free, some places starts with End Hunger. These organizations can have many different kinds of names. Some of them are Hunger Free blank, put in your location there. But no matter what you call it, there becomes sort of a recognized coalition entity that's really formalizing coordination efforts on a larger scale. And that's where that begins, the formalizing. And then groups go to maturing, where they've created a sustainable network. At this point, they have political and social capital, and you can have high cross-sector food system coordination and also communication among actors, where they're really coordinating hunger relief efforts. They're identifying where the gaps are in the services or policies that need to be addressed, and they're starting to eliminate those gaps in programming and eliminating duplication of efforts. So this is where what we call the maturing stage. And then finally, the performing stage is really the idealized, setting where the community achieves high food security. You have a robust emergency response in place for crisis or any response situations, disasters, for example. But you also have full community engagement in federal nutrition programs. So that's where, that's sort of the idealized goal. And so this is our theory of change around hunger-free communities. And we're going to get into a little bit more of this as we think through how this gets implemented and how it connects to collective impact. So I think that's my last slide. Amanda, let me know.
Thank you, Minerva. And as Minerva articulated, hi everyone. I'll introduce myself shortly, but just to let you all know, this HFC 101 session really focuses on the first 4 levels of this framework today. It is a 101 session after all, but there are many other sessions talking about maturing and performing within this context. So hi y'all, my name is Amanda Bankston. I'm a doctoral student at the Maxwell School of Citizenship and Public Affairs at Syracuse University, where I study collaboration for social change. I'm part of a research center where a bunch of folks look at conflict and collaboration, both in theoretical and practical terms. And I'm delighted to be with you all today and to work with the Alliance to evaluate and assess and analyze the HFC network. And so looking at that, one of the things that's really special about this approach is that it addresses the multi-level nature of collaboration. And what I mean by that is a lot of times when we think about HFCs, we think about day-to-day operations, right? We think about in practice what's happening on the ground at this operational level. But we really can think of that as just the tip of the iceberg. Submerged under the surface, things that you can't see involve things like the structure of collaboration, which is something collective impact helps us think about. How do people work together? What are the formal rules? How do we integrate and coordinate across channels and the like? But undergirding all of that, of course, is the system context. This is all happening within political and social systems, right? And so what these theories do and what the HFC approach does is it braids together various theoretical lenses and practical lenses from across decades of research and practice in ways that are dynamic and responsive to what's happening in communities. And by the way, this framework comes from Mandel and Keys, who are network scholars. But I just presented a really nice, clean little pyramid. You all know collaboration looks nothing like that. It's messy, it's dynamic. And one of the cool things about this framework is that it allows us to look at a dynamic system in creative ways. So this is an integrative model that's really popular across the collaborative sphere because it kind of tries to articulate some of that complexity. So when you're dealing with hunger, you're dealing in this system context. Again, there are many players, there's politics, there's economics, there's current events, things like COVID happening. And in these early stages, responding and awakening, you might be concerned with drivers. Again, what are the gaps in community? What are the needs for coordination to even happen? There might be duplication of efforts and the like. So what this model and this framework allows us to do is really focus again on that system context and those drivers in responsive ways. Then we'll talk today a lot about formalizing and coalescing. This is what happens in the black box of collaboration, what happens within a coalition. And there's several dynamics that are happening. We'll talk about those a bit later with Megan. I'm going to try to get to that as soon as possible. But those are really in the coalescing and formalizing stages. We're looking within internally at those structures at that organizational level from the last slide. And then finally, when you do get to the maturing and performing levels, you're starting to look at that data driven approach. You're looking at how your actions, your collective action impacts the system, shifts the system, you're responsive, you're adapting to what you're hearing. And a lot of the other sessions that you'll see throughout this summer focus on that kind of interaction. So again, the cool thing about this model is as an intermediary, the Alliance helps you navigate all kind of levels of collaboration across the system. And again, this integrative framework comes from Emerson, Nabachi, and Ballo. We're going to focus a little on these collaborative dynamics by looking at the collective impact approach. So you've probably heard this somewhere in your life, collective impact, and you might have heard it a couple different ways. People talk about this same thing with many different conceptual lenses. But when we talk about it with the HFCs, as Minerva just articulated, we're really talking about an approach introduced by Kania and Kramer from the field of practice as consultants, where they said, hey, we're not all baking the same cake, and we don't have one recipe for how collaboration might look, right? It varies, but we do have some ingredients and tools that need to be at the table to find success. There's 5 conditions. The first is a common agenda. Everyone's under a shared vision. We're all at the table with an understanding, a common understanding of the problem that we intend to tackle. And collective impact is about building an infrastructure for sustained collaboration, not just one-off projects and collaborations. And so with that comes shared measurement. One of the projects we're looking on looks at hundreds of cases across the globe of collective impact. And this is a sticky area. So if you have some questions around shared measurement, I wouldn't be surprised. This is about collecting data in the same way so that we're accountable as a system. Then there's mutually reinforcing activities. We might have duplication of efforts. We might not be all playing in our strengths. This is about differentiated approaches and making sure there's coordinated action. Finally, another really sticky, tricky piece that we're seeing is continuous communication. This is about establishing that trust and open dialogue among participants, making sure everyone's at the same page, on the same page at the same time, which can be really tricky for, again, those of you who are doing it, the 50% of you who identify as HFCs. And then finally, the important contribution around collective impact, in my opinion, is backbone support. This is a separate and coordinated organization. So one organization steps up and said, hey, we're going to take care of this back end piece of the coordination piece. We have the staff capacity to go ahead and coordinate, okay? And so this backbone piece, a lot of the HFCs that we see do identify as backbones. And I know we haven't come up with a better way to talk about this, but you might think of the HFC network as a backbone of backbones, or I recently started saying a neck bone. It's the most flexible part of the spine. It determines what direction we're heading. And this, along with, you might have heard communities of practice, networks of knowledge, we can glean from all of that kind of research and practice that collaborative leaders, it's really tough, like we just said, theoretically, and even harder in practice. There are 4 levels that Minerva already articulated, so I'll just quickly go through levers that they can kind of pull. One is convenings like today, happy to be here, sharing knowledge. The other is a resource library. So if you look on the website, you'll see a treasure trove of information around best practices and toolkits. And as part of our research, we're looking at how those are utilized. Then there's direct support. So you have access to a network of leaders facing the same problems and experts like Minerva and Megan who have a really good understanding and bird's eye view of what's happening in the field. And then finally, what you heard in the plenaries today is around policy advocacy. Critique of collective impact is that there isn't enough focus on equity pieces and policy pieces, but the HFC approach really does focus, as you've heard, on those areas. And so if you're wondering, how do we evaluate this? How do we articulate the importance of all this work? Well, we're working on it through a research project I'll briefly tell you about. It's a multi-pronged approach. Again, we're looking at literature, we're looking at case studies of HFCs, surveys and focus groups to try to really look at what the impact of this network is and can be. And we invite you to stay in communication with us about that. But the part that I'm sure you're all waiting for is to hear from Megan Lovelace, and so I'll go ahead and introduce them and allow them to talk a little bit about what they do before we jump into a Q&A where we can move from the theories to the practice and what this actually means and looks like in the field. So Megan?
Howdy all, my name is Megan Lovelace, and I work as a farmer and an advocate across the state in Colorado. I farm with my family, raising a variety of crops, and come to this work through living experience, having experienced hunger both in my youth and currently with my family. What a conundrum, a hungry farmer. But that's why collective impact is so important. I also serve on the board at the Alliance to End Hunger, the Butterfly Pack, the Colorado Blueprint to End Hunger, and Colorado Children's Hospital. Thanks for having me here today, and I'm looking forward to our conversation. Back to you, Amanda.
Thank you so much, Megan. I'm so excited to speak with you and learn from you and Minerva, true experts. This is going to be great. And so now we can look at all these puzzle pieces we just laid out and look at how they really work. So we're looking at the impact framework. And for those of you joining us, we decided maybe we'll walk through it using the Colorado Blueprint and Hunger as a case study. So let's start at the beginning, Megan. So in those awakening and responding kind of stages, what was the landscape like prior to the blueprint? How did the need for something like this become apparent? And really importantly, we're curious to know how you got involved.
Sure. So the landscape prior to the blueprint to end hunger maybe looked a little bit familiar to those of you joining us today, in that there were many organizations with similar missions and a lot of passion around ending hunger and making sure we were really reaching our communities. However, sometimes we weren't necessarily speaking to each other. And then, of course, there's grant money, right? So we were all competing for the same grants. And that doesn't create an environment of collaboration, right? And we knew we needed that. So there is a foundation in Colorado called the Colorado Health Foundation, who recognized this and decided that it was time to convene all of the stakeholders that were currently working in the anti-hunger space, bring us together to have an open, honest, and sometimes difficult conversation around the ways that we approach this issue and how we truly hope to solve hunger in the state of Colorado. I came to the work as one of two folks invited to the table with living experience. Now, Colorado's a pretty big state, so that's a lot to talk about for just two people. But it was a great start knowing that they were bringing folks with living experience to the table from the very first conversations. My dog thinks so too.
I agree with your dog, Megan. I look forward to hopefully in the Q&A, as folks open up questions, to hearing more about that integration of living experience. But let's go ahead and look at more specifically at collective impact and those coalescing and formalizing stages. So now you realize this need for coordination. What does this collective impact and this formalizing look like in Colorado? So let's start at the top. Is there a backbone organization supporting the Colorado Blueprint, and how did that come to be?
Well, interestingly enough, when we convened, we really had such a broad group of stakeholders, and maybe each of these different organizations thought they might already be the backbone. As soon as we got in the room together, what we realized is we all held a specific component, but no one held all of them. And because of the convening, we had state departments, community groups, individuals, people from the healthcare industry, housing, transportation. We're thinking about all the ways that we can work together. And what we realized in the end is that the Blueprint to End Hunger would be the backbone. And so we became this 5-year initiative to end hunger in the state of Colorado, and we are the backbone organization.
Wow, that sounds amazing, Megan. And I love the way you kind of told that story. But having worked inside these collaboratives, I know that there can be challenges around establishing a common agenda with all of those different voices and interests and perspectives. Can you tell us a little bit about what that looked like in Colorado?
Sure, as you mentioned earlier, it was a little messy and we always didn't agree. But as we know, the only place where true growth happens is when you're uncomfortable. And so we got comfortable being uncomfortable immediately because we knew the work was important and we needed to get there. And so we gave ourselves permission to be brave, to speak our truths, to disagree, to really value each other in those spaces, even when we didn't come together. And when we created that space for each other and ourselves, what we realized is we were more eager to come to the table and not remind people what our organizations were doing as much as what we really had to give. We were able to step out of our identities as our individual organizations and step into the mission of ending hunger in the state of Colorado. And once we didn't carry that identity of just our organization with us, it was so much easier to say, hey, you know what we do really well is this. And you know what we don't do so great is this. And then someone else in the room would say, we do that so well. And so when we put our, for lack of a better word, egos or agendas, personal agendas aside, that's when we saw that growth. That's when we really were able to see how we all fit into this equation and where we could make the most impact, because we were always thinking, you know, we want to do this with the most efficiency, the most effectiveness, and we want to think in every step, how is this affecting the end user? My end user in one organization is going to be different than the end user in a different organization. But in the end, all the end users are experiencing hunger. And so that was a space for us to all come together and decide how to create a better space for everyone, no matter who you are or where you are, to have fresh, healthy, nutrient-dense food easily and with dignity.
Thank you so much, Megan. I'm just going to interject here because what you're saying is so critical to collective impact in terms of establishing the level of trust that it takes to really work together and to put those personal and organizational agendas aside. I would love for you to give people a sense of how long that took. And we know it's going to be different for every group, but I think people underestimate how long it will take to get to that point of working together efficiently, having established that level of trust.
Sure. So for us, it was 2 years, locked in the boardroom, having it out, if you will. And it was not always a pretty scene, but we needed to do that. If at any point we had backed off of that, if we hadn't held ourselves accountable to what we had agreed to do together, so 2 years of really brainstorming and then pausing and saying, wait a minute now, if we've decided this is great, is it really great? And let's take a minute. And it is an up and a down, and it is one moment of cheering and saying, gosh, we have really, really done this. And then the next moment of going, oh my goodness, what have we done, right? And allowing for that space of knowing that there are going to be missteps. But that's why when you have the stakeholders at the table, that you know, even in the spaces where it doesn't feel great, that there's somebody ready to take it to the next step, even if it's not all the stakeholders. And so then pausing there to allow everybody back into that space. But you can't rush this. I feel like the more you rush it, and even in those 2 years, we rushed too much and left people out. And so after that, when we presented our document, then we had to pause again and say, hey, you're right. You weren't there. Let's bring you in. And iterate and iterate and iterate. And I think that's where you need to be so mindful of the data piece, because if we had set these data sets for ourselves at the beginning and said, well, this is how we're going to get to the end goals we have within our document of the Blueprint to End Hunger, if we hadn't allowed ourselves to think about the ways that we're getting there creatively, because we had given ourselves data that was keeping us in a box, I don't think it would have worked. And so being mindful of how you're tracking that, being creative about how you're tracking that. Maybe you've got to come up with your own data sets because what you're looking at using isn't appropriate to the transformational work that you will be doing. When we still have hunger, it means that maybe we haven't really figured out how to end it, right? And so if we're all trying to end it, we have to look at the data sets too. And so we were creative in that space as well. But I would say be patient, give yourself grace, give the other stakeholders grace, and know that it's okay if you don't have all the answers, because as soon as you put it out there and you're doing that work, people are coming to you, and it's all the things you didn't know, they do. Again, I will point back to living experience, our end users. Bring them in from the very beginning and have them meaningfully in every conversation, because we can guess how it's going to work for someone, but if we're not those people, then we don't know. And so that would be my my advice for how to make sure that you keep the train on the track in the process.
Thank you, Megan and Minerva, for pointing out that the 2 years is actually lightning speed. To me, that sounds so fast when you look across the literature. That's not to scare anyone or to deter anyone. That's just to say, right, like you said, iterate, iterate, iterate.
And I think one of the reasons it was important to point out is that we have seen so many efforts fail at this point before, because they're not willing or just don't have the time to put into really building a strong coalition based on trust between all of the partners, and that's where it falls apart. And so just to let people know, it's very possible, but you have to put in the work and the time, and it's all about relationships and building those relationships.
Absolutely.
And to the funders, oh, sorry, go ahead. Well, to the funders, that it's going to take time. And so we need time in our funding opportunities as well. If the deadline for us to bring you a unicorn is 6 months, it's probably not going to work. And so having those honest conversations with our funders as well, and saying if we do want to transform, it can't be on a grant-based timeline. It has to be on a human-based timeline. And so we're all learning together, including our funders. Bring them in at the very beginning too, and say that these benchmarks, these benches you'd like us to sit on aren't the benches we need to be sitting on to get where we need to go. So let's all get off the bench and let's all go together and rethink the way that we fund the work, we measure the work, and we meet everyone where they are in their communities with dignity.
Say that again, Megan. That's a whole session in and of itself. Like, how do you fund this work? How do you evaluate this work, right? It's if you're building a new system, if you're dismantling and building a new system, that doesn't happen on a project-based timeline, and you can't create a log model necessarily, right, to map that. So thank you for that great insight. I don't see any Q&A. If anyone wants to jump into the conversation and send any questions, we definitely invite that now. But I also just want to get to, so you mentioned community-led work groups around kind of this idea of mutually reinforcing activity. Can you talk a little bit more about that work? I thought that was a really great contribution. And specifically, it's the equity lens we've talked about.
Sure. So when we developed the blueprint to end hunger, we also developed sort of an equity matrix that we would put everything through to really be thinking about how this is affecting the communities across the state, which are so diverse, and that we would make sure that if we hadn't heard from the community we were serving, and not a survey, not a focus group, but in fact leadership, and how could we do that meaningfully? So we have 5 goals with the Colorado Blueprint to End Hunger, and they're very aspirational. So we knew in order to get to these goals of ending hunger in our state, we would need to create working groups and project teams. But we didn't decide what they were. The community decided what they were. So bringing in trusted leaders already living in these communities, we invited them in to bring proposals for projects, work groups around our 5 goals. And we were flooded with so many amazing ideas. And there wasn't a lottery or this one's good or this one's bad. It was knowing that you know what's good for your community, and let's make sure that y'all can do that. And it was what policies do you need? What money do you need? What leadership do you still need, or are your leaders that we can lift up? And then handing over the power. The whole point is we're not keeping any of this power. We don't want to extract the power from the communities. We want to keep the power in the communities. So through the project teams and the working groups, what the blueprint can do is offer that kind of overarching support. Let's get you the money. You tell us. Let's get you the resources, but you tell us, not us telling you. We created a grant funding program that was very quick turnaround, very little paperwork, reporting, all the things that make it kind of scary for community organizations that don't have a development team or maybe even one staff member. But we also thought about that. Let's change that. Let's get some staff. How can we help you there too? So really meeting communities where they were at, not assuming what they needed, asking how can we support, and then just being there without barriers. Is it perfect? No. Do we miss people? Sure. Are we trying every day to get better? Yes.
Excellent. And I have one more question for you and Minerva, and then I see we have a wonderful question from one of our participants today that I can't wait to get to. My last question for both of you is about the relationship between the Colorado Blueprint and the HFC network. So could one or both of you talk about what having this kind of intermediary support mechanism has meant and what it's like to work together?
Well, I can jump in first just on having the Colorado Blueprint and Hunger be part of the Hunger Free Communities Network, I think has been so invaluable because they joined us as they were developing the blueprint. So we kind of saw the evolution of it through the network. And, you know, and I think it really helps other states say, hey, we can do this too. And I think it's such a great example of how to pull together these really broad stakeholders in a community coming together around a specific plan. I mean, I don't remember offhand, Megan will know how many goals there are in the blueprint. I think it's 5 or 6, but they're very clear. And what I love about it is, you know, they bring the entire community together, the anti-hunger community with the business community, faith community, you know, to just, and government agencies to say, okay, let's work together towards these goals. So I think it's also a great mechanism to raise awareness around hunger in the state. So we've just loved having them as a partner to be able to showcase to other states, you know, what's happening and what's possible.
Thank you. And on our end, what we knew is that if we didn't have a kind of an idea around how to achieve something, or we were getting stuck, what we knew is that we could reach out to the Hunger Free Communities Network and say, hey, what are you guys doing on school food? We're really stuck in this one spot with school food, or you know, we've got a lot of help from Hunger Free Communities around college hunger. We were just real stuck there for a while. And so spaces where we maybe didn't have the answer, even with all our stakeholders involved, or we didn't have a mechanism, or we needed a point person that can kind of guide us. We knew we could go directly to the Hunger Free Communities Network, ask our question, aggregate that out, and then come back with some really incredible human beings, organizations that helped us along the way. So it really is this brain tank of fierce and passionate advocates that do believe that there is a way forward with dignity to meet people where they're at and alleviate grumbling bellies at night. And so the HFC has been invaluable for us there and continues to be invaluable for us. And just as an example, I was recently invited in person to the White House Conference on Hunger, Health, and Nutrition. And as an advisory member of HFC, so were, three other people in our advisory network. So these are folks across the state who are dynamic and doing amazing work. And they're at your fingertips when you're a member of HFC. So from the very beginning, we knew that we needed to be a part of the HFC if we were going to be successful as the Blueprint.
Thank you so much. And we're now officially, although they've been open the whole time, opening to all questions. And our very first one, again, is for both of you. So Tracy, thank you for your wonderful question. Do you have examples of how things you would have accomplished together? There are things that you accomplished together that you wouldn't have separately. And so I'll ask both of you, Megan, if you can speak to your experience in Colorado, and then Minerva, can you think of some cool projects from around the network that never would have happened in siloed, uncoordinated communities?
Sure. So I'm really excited about this one. What we heard a lot as we traveled across the state and met with folks, with leaders in the community, was our farm workers were being severely abused. There's no other way to put it. And we're an agriculture state, Colorado, second largest industry in the state. And it was eye-opening, it was heartbreaking, and we knew that we couldn't just sit back and watch. And so we coordinated with Colorado University. We coordinated with several community organizations, created a promotora network of fierce and amazing advocates in those communities that were bringing forward some horrible stories, but some very concrete asks as well. And it gave us a framework to move forward with some legislation. So last year with Fatima Ahmad leading the work through Frontline Farmers in Denver. Just this woman is one of the most amazing humans you'd ever meet on the planet, and wrote some amazing legislation that led to a farm worker bill of rights. If you don't know, farm workers don't get overtime or aren't paid the way that we would pay any other person in any other industry. They're often very severely neglected, coming from other countries, not having clean water. So in our Farm Worker Bill of Rights, it was things that maybe some of us take for granted: a 40-hour work week, getting paid for overtime, breaks, shade, clean water. And because many of them are on visas, things like housing, safe housing with plumbing. It's horrible to think that in 2022, there are so many people living in the shadows. And so we ran some legislation and we got it passed and we got sued. And it's fine because we're running some more legislation to hold folks accountable for not following the law. And could we have done this on our own? I don't think so. But because the Blueprint was there to offer the resources that the promotoras asked for, right? Not what we thought they needed. Because Fatuma was so fierce and brave and said exactly, we need these things and this is when we need them and this is how we need them. And we listened and we acted and we hired a lobbyist and we went to the State House and we ran legislation and we stood in the way. When people were angry, we took that so that the farm workers didn't have to be afraid to speak out. And we're continuing that journey today, running more legislation. And if you join tomorrow, you can meet some of our fierce promotoras for a session to kind of learn more about that. But what we know when we have this collective impact, where we have this much, let's call it power, because it is. All the state departments, all of the people that are CEOs and people are listening to them, right? It creates a space for every voice to be heard. And we can take that power and shift it to our communities and truly transform. We're also seeing at the federal level, the Farm Worker Modernization Act, where, maybe we can fix it there too. So we're not giving up. We're going to make sure our farm workers and their communities are well cared for, because every day we eat food, we're eating their hard work and labor and love. So that's, I think, a really great example, and I invite you to join us on the journey.
What a wonderful example. Thank you, Megan. And it just goes to show what you can do when you do center equity. And just really applaud you all for doing that. That's wonderful. I think throughout the network, we have so many great examples of work that's happening. But I'm actually going to first talk about something that happened a while ago, but I'm going to go ahead and add it to the
Minerva, you muted
I
yourself.
muted
There you go.
myself. My mistake. I didn't mean to do that. So I think I said I was going to add something to the lobby chat. I'm starting with sort of an older example, but if you're not familiar with it, I think it's really important because it's Hunger Free Minnesota's report on their collective impact project. Now, this happened a while ago. I think it was 2011 or 12. And it lasted for 3 years. But this was also an effort where different sectors came together specifically to close the meal gap in Minnesota. And they set a goal for themselves. They developed just all of the things you were talking about for collective impact. They had backbone support. They developed a common agenda. They decided on a shared measurement, which in this case was the number of meals served. So for every single partner, they had to convert whatever their part of it was to this metric so that they could have so that they could hold each other accountable, but also really assess the impact of what they were doing. So, if it was gleaning from farms where normally what you get is pounds of food, they had a mechanism for identifying the number of meals based on the pounds. If it was a SNAP outreach effort where what you're measuring is the number of people enrolled in SNAP, they had to come up with a basic measure around what that meant in terms of number of meals, for that individual. And so having that common measure and shared measurement was absolutely critical to their effort to be able to measure their impact. They had a goal, I believe, of closing the meal gap in the state by 70 million meals was the goal. No, 60 million meals was the goal, and they exceeded it by 10 million meals. So it really, please read the report if you're not familiar with it. It tells you who all the different partners are, how they went about it, what each, they involved schools, they involved healthcare, they involved the faith community. I mean, there wasn't a part of the community that wasn't involved in this, and it was very successful. So the advantage of this, and the reason I like to share it, is like they put out a report. We have lots of great examples. We don't always have like great documentation to actually show what they did. So for those of you who are doing this work, please document it. Everyone else wants to know how you did it, what you did, what your outcomes were, what your lessons learned were, and we can talk about that offline. But part of what we're doing here through our effort is trying to develop some of those case studies so we have more great stories to share. But just two other examples I will say, and you can access through this conference. So New Hampshire has put together a hunger action plan. They are presenting tomorrow at 1 p.m. So feel free to join that session and learn about what they're doing, or catch the recording later. An on-demand video for this session, Montgomery County Food Council in Montgomery County, Maryland. There are a number of Montgomery counties around the country, but in Maryland, the Montgomery County Food Council is implementing the county's food security plan. So there's an on-demand video that you can watch anytime. just go to the agenda on demand videos, and you will see just highlights for what they accomplished last year. But the fact is that they have a county government that has put together a food security plan. If your county or city government doesn't have that, this could be a great sort of just template for you all as well. So I'm going to stop there because I know we want to get in more questions before we wrap up.
So many great examples. I will lift up the documentation and do my job as the research interest on the call. We have another great question from Nick. And again, we invite questions. We do have some time left. But Nick says, and it's a question for you, Megan. Wait, Nick has two questions. So the first is, could you have better shared power with folks with lived experience in the creation of the blueprint? And then I'll share the other question so you can take them both. Did you limit yourselves in how many organizations could be involved? And was there a point when there were maybe too many cooks in the kitchen? How do you strike that balance?
So I'll start with the shared power and just say, yes, absolutely, always. And I want to say shift power, because if you are not walking in those shoes, if we're just guessing about the end user experience, right? How do we know? So the only way to truly know is to lift up our current community leaders and pay them the same way we would pay any of our colleagues. And they're the leaders. Put those folks like myself, food insecure, in those leadership positions. That's transformational. So while we can talk about it, we should be doing it. And I think that, when the blueprint was created, we were having those conversations, and there were a few of us at the table, and we have iterated substantially since then in how we look at leadership. And I would just encourage all of your organizations to rethink what it means to have the voice at the table. It's not a focus group. It's not a gift card. It's not, hearing from a couple folks one time. It's building your business model around living experience in sustained leadership roles, and knowing that this is where the transformation happens. So that's what I'll say about the blueprint. No, we did not do that as well as we could have. The second question, how did we limit? That was something that the Colorado Health Foundation initially sort of put a roadmap on, right? We want the state departments. So we had all of our state departments there. We had sort of our heavy hitters in the food insecurity space and in the anti-poverty space. It was a very big table. But what we realized is it wasn't big enough, so we just kept inviting people in. Too many cooks in the kitchen. I would just say to that piece, it can feel like that. So it's really important to have, good facilitation to be able to create those working groups so that you're not trying to kind of, eat the whole elephant. I don't want to eat the elephant. I want to pet the elephant, but to the point of taking on too much at once, right? And so, but too many, I think, get out of your lane. There's never too many. If you're finding people with passion that are doing the work and want to come to the table and contribute, then that's not too many. The issues around hunger stem from poverty. The issues around poverty stem from racism and oppression, right? So if we're just going to talk about hunger and we're not going to address everything else, it's silly to think we're ever going to solve hunger. And so, yes, invite them in, because this is how you collective impact, how you solve that work, and how you have those honest conversations and keep having them. Because if it's just a few folks trying to, pat themselves on the back about some good ideas, then it's not collective impact. So I'll say to that.
It's a great question. And there's actually people running a lot of fancy models to try to find the ideal numbers for collaboration and running all these things. But I think your answer, Megan, in practice is really insightful. So now we have about 5 minutes left, and we are going to save some time so you understand how to get to the networking portion that comes right after this session. But before we get there, really, really important question. And I again want to lift up documentation, storytelling, and research, the things we're working on together. Because this question from Tracy asks, how is a backbone organization funded?
So it's creative. It's not always one thing. Oftentimes it's many things. And when these different organizations come to the table as stakeholders and are offering what they're offering, part of that is the letting go. The letting go of thinking that your organization needs to be the only one that's funded. Sharing your donors, sharing your funders. And by the way, funders love this, right? If you come to the table and say that we have these 10 groups that are all working towards this common goal, so you have to be brave. And your funders do too. We actually have a funders committee at the Blueprint to End Hunger where we work very in depth with our funders because they are coming along on that journey. For us, because the Colorado Health Foundation is a foundation, they seeded this work. And what we know from there is that having those data sets, both traditional and non-traditional, because we want to show these non-traditional data sets of long-term, sustained economic autonomy that truly frees our communities from hunger. Those aren't going to be the data sets they're used to seeing, but we need to show those. And so approaching your funders with bravery and saying, please come with us on this journey. This is how we don't have to be orgs anymore. This is how we return our communities to dignity. And it's a work in progress, but the more all of us are actually asking our funders to step outside of their traditional funding mechanisms and fund these backbones, the more success we're going to see. So we're grateful to the Health Foundation for being brave with us.
Great. And Minerva, if you have anything to add around funding, but if not, I know we reserve some time so you all can learn how to get to the really great networking opportunity that lies ahead.
Yeah. I mean, funding is a typical challenge for nonprofits, but this kind of collective impact is usually very appealing to funders because they understand that the return on investment is much greater in this kind of a project than what they typically fund. So, many times it's the Health Foundation that is investing in this because they understand that improving food security, improving nutrition in a community lowers healthcare costs, right? So you have to think creatively about who might be interested in this kind of collaborative work. But yeah, I think we can wrap up and actually thank you all for joining us. We really appreciate that. And I'm going to turn it over to Mary to show us how we're going to go into the networking. And also, please